What if the key to scaling your healthcare investments and driving growth isn't just about securing the right deals, but about building a strong compliance culture from the start? In this episode of the Compliance Advantage podcast, Ross sits down with Vitaly Goldfeder, principal at RC Capital, a healthcare-focused private equity firm that specializes in healthcare services and medical technology. Vitaly shares how healthcare leaders can turn compliance into a strategic advantage. They discuss the challenges of scaling businesses, protecting investments, and the critical role compliance plays in ensuring sustainable growth. If you're an investor or an executive looking to future-proof your portfolio, this episode is full of valuable insights you can't afford to miss.
Welcome to the Compliance Advantage podcast. This is the place where we help at-risk stakeholders in healthcare transform compliance into a strategic advantage. I'm your host, Ross Ronan, founder of Ronan Healthcare Compliance and a healthcare compliance strategist with nearly 30 years of industry experience. I'll help you transform compliance into a catalyst for innovation and growth. Remember, compliance pays dividends. Invest today. Today on the Compliance Advantage, we have Vitaly Goldfeder. Thank you so much for coming on.
Hey, thanks for having me, Ross.
We've known each other, I think, for 5-6 years now, I think. So it's been a great time. And tell us a little bit about yourself and where you come from and what are you doing now?
Sure. Well, I'm a principal with RC Capital. We're a healthcare-focused private equity firm. We invest in healthcare services and med tech. I've been doing this for over a decade. It's been about 3 years at RC Capital. We're based in Cincinnati, where I grew up. And before that, I was an investor in New York with Enhanced Healthcare Partners, which is where I think we got to know each other. And
Absolutely.
really began my career before that in Chicago in investment banking. And actually, little known fact, started in debt restructuring during the Great Recession. So I got to learn how LBOs don't work first before finding my way to M&A.
Nice. It's funny when we talked and you went over to RC Capital, I was like, does Ohio actually have private equity firms out there? And you're like, yeah, that's where I'm from. I had no idea you were from Ohio. So,
well, we do. And actually, it's interesting because when we go out and meet with companies and founders, healthcare is so fragmented, it's so local. And more often than not, we're in a place like Ohio, not in a place like New York City, meeting with these founders and entrepreneurs and doctors. And we like to think it's refreshing for them, but you'll have to ask our portfolio companies that.
I will. And we actually do quite a bit of work in Ohio with different behavioral health and different other kind of healthcare entities out there. So it must be a great place to have land and property and a business to do well. So
yeah, and it's a great place to live. My kids love it. They've got plenty of room to run around. We do invest nationwide.
Yeah.
And so other than traveling with lots of connections, it's been a good run.
That's great. All right, let's start a little bit about what kind of book, philosophy, person has really influenced you the most in the way you approach, whether it's life or work or being very successful at a private equity firm and being partner and investor or principals in those. What has kind of driven your philosophy? Is there some sort of book or person out there that you really kind of look up to as a mentor?
Yeah, good question. I think that I don't know if there's a single person I can name or even book per se. The most recent book I read is called Leadership and Self-Deception.
Okay.
It's by the Arbinger Institute.
Okay.
And it's somewhat similar to one that I think a lot of people have read that's called Making Friends and Influencing People. And it's really about how to build teams in a way that those around you, the folks sitting next to you, the folks above you, the folks below you feel seen and heard and thus empowered, which allows them to work at the top end of their license, so to speak.
Yeah.
And we think about that a lot in our business, given we're typically investing in smaller companies that are at an inflection point that may have a team that needs complemented or supplemented, or may just be assembling a team for the first time. And that's a hard challenge for any individual. It's a hard challenge for our business at the board level to manage all of these personalities. And so really thinking about the relational aspect of how do you understand where somebody's coming from, spend the time to do that without just being so inside your own agenda and your own goals and anxieties, to take the time to, relate. And I think that's what, in my mind, builds a cohesive team, and the people have an outsized impact on these kinds of businesses
Sure.
that we're talking about today. So it's really important.
And you work with a lot of founder-based businesses, right?
For the most part,
Yeah.
our strategy is really around partnering with the founder on the services side, where we're largely the first institutional capital that they've ever brought on.
Sure.
They typically have a proven model, proven unit economic model. They're advancing patient care. They're improving access in many cases. And they're really looking for a partner to create the infrastructure to scale, what they're doing on a local, regional level to be ultimately a regional or national leader in the space.
And with these leadership books, or how to actually lead and lead your teams, what I've found with working with a lot of co-founders or founders of businesses too, is they really don't know how to do that, right? They have this really special skill set that has brought whatever they've sold to the market, whether it's a service, it's a doctor, it's a device, or whatever it may be. They're bringing something to the market, and they're really good at that thing, but may not know how to lead a bunch of people. So having these kind of resources, and from a private equity group that can partner with you, is really important to be able to understand how it works.
Yeah, that's a great point. And as you build scale,
Right.
your reach as a leader diminishes,
Exactly.
right? And that's when the infrastructure and the people and processes really come to be the linchpin of what we're trying to create. It's what we try to instill in the management team, that, hey, you need this. Maybe today it even feels a little early for this kind of solution or decision matrix or FTE, whatever the case may be. But as we go from 5 to 10 sites, or as we enter an adjacent state, how are you going to translate what you're doing naturally and organically across an organization that's growing 50% a year? Maybe it's growing 100% a year. And that's where those processes and standardization really starts to bear fruit. I think if you've ever been at home and walked around your house with all the lights off in the middle of the night, you don't need to turn the lights on.
That's
you know where everything is. But that's a little bit harder to do when in a strange environment that you don't know so intimately. And that's what I think a scaled organization starts to feel like for some of these founders.
What a great analogy. I mean, I was just in a hotel over the weekend, and I think I banged my foot onto the stool that I didn't know was there, and spent 20 minutes looking for the light switch for the bathroom. Yeah. And I think it's funny that you make that analogy, that, yeah, it's something you've done for years and years and decades, that you can just kind of operate in this vacuum. And then when you try to grow and build that business, you really do need that infrastructure of someone turning on the light for you. And I think that's a great analogy. Now, you and I have worked on several different things in the compliance realm, and we continue to work together because I love your perspective on compliance and how you guys see that working in your, not only your private equity group, but your portfolio companies, and how you take that to heart. With that said, when you think about compliance, what is the common misconception that you see that healthcare executives, whether it's investors, private equity, boards, CEOs, really have about what compliance does, or whether they should have compliance or not in their organization?
I don't know if this is the most common, but one that I think we run into now and again is there's a perception that it's an impediment to growth, or it's an impediment to moving quickly, or it's an impediment to innovation, right? Here's a set of rules that I'm being asked to adhere to, or a box that I'm being asked to live in, and this somehow hampers my mission. I think that is a sentiment that many entrepreneurs feel, or that we've seen entrepreneurial companies have that kind of mindset. And it's not often even grounded in the fact that they're necessarily not being compliant.
Yeah.
In many cases, they are the majority of the time. It's just that, hey, now there's codified rules and processes and procedures that, they feel imposed on the organization, and that's somehow going to lead to people marching in different directions, right? It makes it easy to say no
Right.
to growth or no to a new service line
Mm-hmm.
or a new way of doing things. That doesn't necessarily have to be the case,
Right.
but often, to the extent people push back on making compliance a big part of the organization, a big part of the strategy or board governance, I found that some of those sentiments are underpinned at the end of the day by speed, growth, flexibility, those kinds of factors.
I think compliance in and of itself, compliance programs over the years have probably created this problem for themselves, right? So now compliance, we talk about all the time being the compliance advantage, right? What advantage does a compliance program, a fully effective operationalized compliance program, what does that benefit those that are either invested in companies or the companies that are running themselves? And I think in the past, compliance programs have always, been this, I'm the police, I'm going to make you stop, I'm going to make you stop doing X, Y, and Z. And that's kind of how the government would like it to look too. But a mature and evolved compliance program thinks about it something a little bit different, where they say, how am I your strategic partner? How am I going to help you grow? How am I going to help you accomplish what you need to accomplish within the guardrails that you need to have? So,
yeah, I think that's well said. And we spend a lot of time thinking about what are the points where that needs to be woven into the fabric of the organization.
mm-hmm.
And that's at the board level, it's at the senior leadership level. We think a lot about how then to permeate that down through the organization across the various stakeholders to create that partnership. And so it demystifies, that process. It demystifies what compliance is really supposed to be about, or that bugaboo, I guess you could say.
Yeah, the perception is so weird, right? It's that perception that compliance is going to stand in your way. And it is going to stand in your way from breaking the law. But as you said before, 9 times out of 10, it's not necessarily about doing something wrong. It's just about knowing what to do. And I think that's the biggest key. And so that misperception is pretty wild out there.
Well, look, I mean, there are rules
Sure,
that we
are.
all need to live in, right? And I think there's risk of
brown bags of money are bad.
Yeah, I mean, there's risk of litigation, there's Stark law, there's kickback laws, all of these things that do exist, and they're uncomfortable and scary.
Sure.
But I think there's plenty of leeway we found around what you can do to achieve your business goals and your patient goals. And I think it's really understanding how the rules benefit the same stakeholders in that partnership.
What's your biggest aha moment when it comes to realizing, because I imagine you probably didn't always have this perspective when you started early on in your career and dealing with maybe not healthcare compliance, but I mean, finance compliance is just as bad as healthcare compliance when you talk about all the rules and regulations from the FINRA and everything else you have to deal with. What's your biggest aha moment when you realize that, wow, if I have a good compliance function, a good compliance program, there is an advantage to that, to my portfolio, whether it's a competitive advantage, a strategic advantage, or what was that aha moment where you're just like, oof, I just realized?
Things come up all the time in our businesses. Little things, slightly bigger things. When you're providing direct care, and that's a part of our portfolio.
Sure. Yep.
on the services side, and you're billing insurance, you're billing Medicare, you're billing Medicaid, you can be as prepared as you want,
Mm-hmm.
but inevitably sometimes little things happen, and it's very cliche. You hear about it all the time, but having done the prep work,
Mm-hmm.
having the processes and procedures in place, having the people in place, and that preparation, seeing it deployed when something happens, and how that goes, how that feels like as an investor, as a board member, what that feels like for the leadership team,
Mm-hmm.
rather than being blindsided not only by the event, but also this realization that you don't know what to do, you don't know who to call, you don't have the tool. That's probably the biggest aha that I've had over my career, which is this is actually relatively straightforward,
Right.
when we've done all of our homework and prep work to get to the point where we are. And I think there's two things in there. I think one is the preparation is worthwhile.
Mm-hmm.
But then the second piece of that is what I said initially, which is some of these things are unavoidable.
Right.
And having a compliance issue that your team or your board needs to solve is part of, being in a regulated industry. It's part of being in healthcare services. And mentoring our executives to know, these large side organizations or evolving into them for the first time, that if you have a compliance event, it's not a failure.
Right.
It's how you respond to it and what you do going forward.
Well said. I will put it that way. Usually I'm the one that actually says those kind of things. I love hearing that from one at your level, at your level of a private equity group, who says, you know what, it's okay that something happens, but it's how you deal with it. It's how you mitigate it. It's what you learn from it. That's more important. And that's how the government sees it. And I do remember, as you were talking about being prepared and having all your stuff together, in my previous life, before I started this company, I was part of very large national healthcare group that, fortunately or unfortunately, had a number of corporate integrity agreements over the years. And I've had the luxury of, and I'll call it the luxury or the fortune, to be able to manage a lot of those, in addition to going public, private a few times with different very large private equity groups. And throughout my tenure, after the second time we had another investor, another private equity group come and invest in us, everything that we did from a compliance program, every folder we put up in the virtual data room, everything that we did was clear, concise, and complete. And I remember everybody else that went through due diligence, the finance, the legal, everybody else had meeting after meeting after meeting after meeting after meeting with the bankers in the private equity group. In compliance, we put it up there one time. We had one meeting on it. And we said, let us know if you have any questions, because we were prepared and had everything to the T. No compliance issues ever brought us down from the standpoint of valuation or exposure, because we were ready to go. And since we did have many corporate integrity agreements, we always had to answer that question too, which was, wow, you must have done something bad because you're under a corporate integrity agreement. And then the reverse is true, is we have a corporate integrity agreement. So therefore we do have a really effective compliance program because we have to. And so that was kind of my aha moment, was really knowing that if you have an effective compliance program that knows what they're doing and putting their stuff together and that is prepared, that others will see you like you are the white knight and you have this clear competitive advantage. And I don't know if you see that in some of the groups that you guys deal with.
This episode of the Compliance Advantage podcast is brought to you by Ronan Healthcare Compliance. At Ronan Healthcare Compliance, we believe in transforming healthcare compliance from a checkbox attitude to a strategic advantage. With decades of expertise, our team of consultants provides innovative solutions tailored to your organization's unique needs. We don't just help you meet your standards. We elevate your business, ensuring ethical practices are at the heart of what you do. Whether you're navigating complex regulations or seeking to enhance your compliance strategy, Ronan Healthcare Compliance is your partner in achieving excellence in healthcare compliance. Ronan Healthcare Compliance, redefining compliance, empowering leadership. Visit us at ronanhc.com to learn more. Now, back to the show.
I fortunately have not had the same intimate experience with the CIA that you have had, Ross. But what I think about when we're thinking about the next home for our portfolio companies, who are going to be those investors? What is their diligence process going to be like? I always think back to our diligence process and the questions that we ask in this arena, and what are the gaps and how we're going to have to fill those over the course of our hold period. What's that going to cost? And for us to have a good outcome for our co-investors and patients ultimately, and our investors, we're fiduciaries of our LP dollars. All those questions are going to be asked on the back end of us. And so if internal motivation was not enough, I think we know all too well what's going to be required at a exit and sale process from a diligence perspective, especially today when the government and even commercial payers are starting to get more active around making sure that you're doing the right thing and following the rules. So that's always a focus for us.
There's nothing more disappointing than getting really excited about a deal, and then you start compliance due diligence and then just something throws it off, and you just get like so bummed that this thing is not going to go through because of some compliance issue that you didn't know about. And on the reverse side of it, it's so exciting when you're like, oh my God, they have all of their stuff together and this is a great deal.
Yeah, no, that's right. And those aren't easy conversations
Right.
with founders around what has to happen to improve the compliance situation going forward, how a business practice might have to evolve if it has to evolve. So you're right. And I think getting those issues out on the table as early as possible is helpful. Building the right relationship with the management team and the entrepreneur to have that conversation is important, right? Because without trust, it's hard to progress the dialogue.
Trust and integrity are huge, right? And I think that's it's a very important point is that conversation needs to be had at some point in time with the founder if you do find something, and that is extremely uncomfortable.
And so there's a balance too around developing that relationship on the front end such that when the issues arise, you can weather the storm, so to speak. But the flip side of it is we prioritize our diligence processes in a way to get the issues out on the table earlier rather than later so that we can be most efficient with our limited resources and our LPs resources and find the best deals and partnerships too.
They need to trust you too, right? The founders need to trust you that you're coming to the table being truthful and with integrity of saying, I'm here to help. I'm here to have you grow. I'm here to help you be better.
Yeah,
so
that's right.
It's
well said.
This is a great question. I love this one. It's really hard to answer and everybody kind of shies away a little bit. But if compliance was a superhero, what would it be?
Man, a superhero.
A superhero. What superpower? What is it going to be? What is it going to look like? What would it be good for you?
Man, I don't know. Seeing the future could be a superpower.
It is a superpower. I think that's a good one. And that is a common response that I hear. So tell me a little bit more about what kind of future would you like to see as compliance?
And here we thought we were all originals.
It's about how you explained it.
It kind of goes back to what we talked about earlier, which is nobody's perfect. In an organization that's growing, things will ultimately arise. And I think being able to have a toolkit, whether it was related to billing and coding, whether it's related to sanctions checking, whether it's related to a compensation model, whether it's related to regulatory certification of a new location, whatever the case may be, the mistakes will get made.
Sure.
Typically, they're inadvertent.
Right.
And having that preparedness makes it a small thing, or if left unchecked, the liability compounds, and it compounds in a very meaningful way because there could be a period of time that goes by that you're accumulating financial liability. If there's a government entity involved, right, you're facing a look back, and some of those are substantial. And so having that foresight and preparedness preserves value and builds value at exit.
So it's really refreshing to talk about being proactive. And I think that's really what you're describing. A lot of times compliance programs are just reacting to things that are happening versus preparing for the future, right? And I think that looking into the future and knowing the future as a superpower kind of fits right into being a proactive compliance program where they are anticipating what's happening down the road and going to make sure that the company is prepared for it. I think that's really important.
Yeah, and I think when we engage you on a diligence or post close, right, we talk about these things, whether it's chart sampling or having a prospective review in place for challenging documentation areas. It's all about that preparedness and limiting the liability and protecting the organization when somebody inevitably makes a mistake.
We often talk about compliance and good compliance programs protecting your investment. And we use those words a lot. And the way that I've always defined that, especially when dealing with private equity and different investment entities who would come in, is not only protecting the investment that you made monetarily, but also as a CEO, as a board member, you're investing your time, you're investing your life, your career into these companies, and having a effective compliance program will help protect that investment. And like I said, the investment can be defined as money, time, career, reputation. How do you guys look at that from that standpoint? Do you guys see it that way as compliance program really isn't as a protection? It's like having insurance, right? It's a protection in my investment.
We do. And I think we think about it in terms of the enterprise value or equity value that that's built and ultimately transacted on at the
Mhm.
end of a hold period. But just beyond that, and what ultimately gets valued, we want to build organizations that endure
Mhm.
and really meet what we call the triple aim at RC. We're serving patients, we're serving providers,
Mhm.
and we're serving payers in a way that advances healthcare, solves problems, eliminates waste, and is not scheme oriented in
Mhm.
nature,
Mhm.
which, because of this complicated regulatory disaggregated system, unfortunately, there are a lot of opportunities for abuse.
Mhm.
And I think our mission is to enable with our capital lasting organizations that serve that triple aim. And when we build a functioning compliance program,
Mhm.
just as important as any other functional area,
Yep.
I think that protects patient safety and
Absolutely.
outcomes, no question.
Mhm.
It protects the reputation and builds upon the skill set of our physician partners who are very impressive. And
Mhm.
we spend a lot of time supporting them and figuring out how to enable their genius.
Mhm.
And look, it protects payers and the system as well, because gosh, there's so much waste and
So
inefficiency
much.
where really we need to do our part in that as well. And so it's 1A, it's always in front of our face in the private equity seat, which is how are we going to have a successful exit process when it's
Mhm.
time to monetize one of our portfolio companies and find the next owner. But the bigger mission really
Yeah.
is creating an organization with lasting value that goes far beyond our hold period. And I think when we meet as investment committee, one thing that has been really cool for me stepping into an organization like RC Capital, I mean, we've been around 30 years.
Mhm.
And to see some of our senior partners, when the name of a company from Fund 2
Mhm.
comes up in the news, I think that's when I've seen them be the most proud to say,
Yeah.
hey, remember when we invested in this thing 16 years ago? And look, this company's still changing healthcare and doing great things. I think that's really rewarding for the team.
I love this triple M. Thanks for sharing that. I think that kind of hits the nail right on the head when you talk about patients, providers, and payers as your triple aim, that you're building an everlasting kind of program with all of these entities and focusing on those three factors, which obviously patient care is always first, right? Should always be first. Patients come first. And the last one, providers, you can't do anything without them. And the last one is really protecting those payer programs, because if they didn't exist, then no one would have the ability to have healthcare, right? Or be able to afford it. So I think really that what do you call it, a mantra, what do you call that,
Could be a mantra.
value, mission, vision, and values, or something like that, right?
We say, hey, who are our customers?
Yeah.
And we think about patients, payers, and providers
Yeah.
as the customers of the organizations that we're
Yeah.
building at RC. The organization is serving patients.
Hmm.
It's up to us to build a support structure that enables the
Hmm.
providers, and we need to be doing the right thing in the context
Hmm.
of the reimbursement ecosystem, whether that's quality, whether that's efficiency, site of care, data, you name it.
Hmm.
And so as we review a thesis or do portfolio review and track our investments, uh, that's the North Star, which is how do we build organizations that are, going to have lasting value? What does that mean at the end of the day on the spreadsheet? They're going to get a great multiple on their
Hmm.
EBITDA, and it's organizations that in a sustainable way serve their customers in those three buckets, we think.
That's great. That's great. And private equity has been such a bullseye for the past year, 2 years, with the government and looking at how they're investing in healthcare, but understanding that, and most of the private equity, all the private equities that we deal with have this vision that it's to build this everlasting thing that focuses on patients, providers, and the payers. It's great. It's great to hear. You deal with a lot of CEOs, a lot of founders, like we talked about when we first started. What's your best advice that you'd give them about creating a compliance culture to hit on your triple aim?
That's a good question. And I think it's just to build a coalition around the effort throughout the organization, both. And I think we'd give this advice to any of our managers, CEO, or whomever. Develop those points of intersection up and down the organization
Hmm.
such that there's alignment and the compliance function is that strategic partner, right? So I think that starts at the board level around having a compliance committee and a chairperson of that compliance committee. We do that with each of our businesses. That really is partnering with the CEO on the strategic level and is that thought partner around how to disseminate that program throughout the organization. And that CEO often is building a coalition inside their organization, activate the mission. And I think that manifests in having involvement from operations folks on their team, the compliance team, bringing in physician stakeholders
For sure.
is critically important, and outside advisors as well when appropriate. And that way, everybody has ownership and everybody's aligned on the mission.
Being involved is really big, right? Because there's a lot of senior leadership, executive leadership who just want to go, you just go do that. And I don't need to be involved in it. And having CEOs and COOs and board members be involved in that functionality of the compliance top down, it really does filter down to the rest of the organization where it builds that culture really well.
It also speaks to, I think, what you hit on early, which is how to have the compliance team be a true business partner, right? And it's integrating them into other aspects of the business such that first and foremost, everybody's aligned on the mission. Where are we trying to go over the next 1, 3, 5, 10 years? What is the strategy? How are we going to get there? And when the compliance leadership of the company understands that mission and are locking arms at various levels around the organization on that mission, that's when I think some of the collaboration can happen. And that's how you sort of break through this idea that you started the conversation with, hey, what's the biggest misconception? It's like, well, this is the place where I go to get told no. This is the biggest misconception. We encourage our CEOs to have the compliance leadership really collaborate and strategize along with the business leaders around what can we do to achieve our goals, not focus so much on what can't we do.
I hope all the leaders are listening to that and take that to heart. So this is great. All right, last question. Ask this to all my guests. What do you do to take care of yourself? Health is wealth from that standpoint. What do you do from a physical, mental, spiritual standpoint to make sure that you stay sane and healthy?
Oh man, not enough for us. We've got, this is a go-go industry,
Sure.
right? There's lots of planes and trains and late night calls, but I love going to the gym. I've been fortunate enough to find the time to do that on many mornings, especially when I'm not traveling. So I really enjoy that. And I had just spending time with my kids on the mental health front.
Yeah.
Was a good way to disconnect and try to put the cell phone down for a couple hours over the weekend. So those are the main ones.
Isn't that the truth? Well, Vitaly, thank you so much for being here today. Really appreciate it. You had some great insights when it comes to the compliance advantage. I know that the listeners will hear this and really learn something from it. So I really appreciate you joining me today.
Hey, thanks, Ross. This was a lot of fun and glad we got to do this in person.
We'll do it again too. I appreciate it.
Awesome. Thanks.
Thank you for listening to today's episode of the Compliance Advantage podcast. If you enjoyed it, please rate, review, and share this episode with someone who might benefit from it. Don't forget to visit us at ronanhc.com for more resources and connect with us on social media for the latest updates. And remember, compliance pays dividends. Invest today.